Doran is my first guest on the show today with St. Thomas Health Partners. So glad you could come in today.
Thank you. So happy to be here, Amy. Thanks for asking.
Absolutely. I know that St. Thomas is growing leaps and bounds, serving this explosive growth in population in Middle Tennessee that I've noticed myself, all of these new places popping up around town. Tell us about your role in sort of redefining this experience for patients in Middle Tennessee. I know that you have sort of helped establish this service standard for care with so many new people moving here.
Absolutely. You know, it's a multifaceted plan that we're actually blessed to be able to roll out at this point. Nashville, as you said, is experiencing a huge population boom, and with that, we have an opportunity to care for more Middle Tennesseans. Just a little bit of history about St. Thomas Medical Partners. We have 102 locations today. We have 4 more scheduled to open this calendar year, and within those 102 locations, we actually have 39 different specialties in addition to primary care. So we've addressed the comprehensive total needs of the patient and how to care for the total health of the patient by adding a full complement of those specialists that are needed. You know, you start with primary care as a gatekeeper, and then you move on to whatever you as an individual may need from a specialty perspective.
You had to do a lot of research to get to this point, to identify, look at your numbers at the population who's moving here, and as the population here ages, what the needs are. Tell us a little bit about that process to get to this point.
Well, you are correct, Amy. It is definitely a process, and it has been a multi-year process. We started this journey a little more than 3 years ago, and it began with an assessment. It began with the current population and the projected population, and really where that growth would be. What communities would those new residents of Middle Tennessee actually reside in? And then we took it a step further, and we said, whether we have a footprint in that area today or not, what is the disease burden or the expected disease burden, meaning the most common or frequent diagnoses of the residents who live in those communities? You know, as we have, I mentioned the 39 specialties, but knowing that primary care is the gatekeeper to all health care and really is the captain of the healthcare ship for each individual patient, we had to look at how to balance that. And so the new sites that you mentioned that we're adding are actually the primary care concentration. Now, those are called community care centers. So in a care center, we have primary care in addition to specialties that will be housed under the same roof, embedded in the communities where those patients live or where the growth is occurring. And so that way the patients can go to their comfort and have the access for the care that they need from primary care or specialties within their community.
So in other words, they don't have to travel. Let's say they're out in the Cool Springs area, Franklin area. They don't have to drive downtown Nashville or to the west side of Nashville.
Absolutely. So the growing primary care, 2 of them are in, well, one is technically Davidson County, but 2 are, you know, in the Williamson County, Cool Springs area. We just opened a new location in December on the corner of Aspen Grove and Cool Springs, and then we have one right off of the Old Hickory Boulevard in Brentwood.
Is there a concern in how you reach those who need health care? Obviously, I know you've done your research on that, you know, as you said, over a number of years, but there probably has been a concern that so many people cannot access care due to multiple reasons. What, transportation, education?
Absolutely. You know, when you look at the changing complexion of healthcare, it is changing so rapidly that you have to not only keep up with what happened in the past, but really the new expectations, the consumerism of healthcare and what those expectations are from a patient's perspective. And so part of that is, how do you reach them? How do you deliver that access? And we've done that at St. Thomas through a couple of means. We've really utilized our ability to access online options, online scheduling, so that as a patient, I mean, we're all busy in our daily lives, so you want care in an area that's close to you. You need it when you need it. And so removing barriers with an online scheduling platform was a first step into that consumerism component that's now part of patients.
It's almost like care on demand, isn't it?
It is, and we actually have care on demand at St. Thomas. You don't even have to leave your home. I think part of that, though, is understanding what location, what is the acuity level, or what's the need. Is it a simple sniffles case, or is it something more severe? So could you, from the convenience of your own couch, could you have care in your own home or in your office? Do you need a walk-in location? Do you need a scheduled appointment for something a little more in-depth? Or do you need a high acuity specialist, to address certain needs if you've been given a diagnosis that needs further care?
So these community centers, if you will, a lot of them, would they have a lot of the same specialists in each one, or would they have various specialists depending on the demographics of that neighborhood?
They would absolutely have differing specialty mixes based on the demographics and the disease burden, if you will, the needs of that community. Some may be more prevalent in diabetes, some may have higher cardiology needs.
Okay.
So we try to match that as best we can with the needs of the patient.
All right, as far as the telemedicine piece of this, because I had interviewed a specialist from St. Thomas about that and how you're doing a lot of the, via Skype or FaceTime for some illnesses. Is that part of the care as well?
It's projected to be a future part of the care.
Part of it.
As far as the care centers, now we already have the St. Thomas on Demand, which is for easy diagnoses, or what we call acute care at home. But I think as we move into the changing complexion, as I mentioned earlier, when the payers, the actual insurance carriers, help direct some of that, meaning the authorization, maybe the reimbursement, as some of those things better align, then telehealth will take on a whole new presence. St. Thomas is prepared. All of our new care centers are already hardwired and ready to go when that lever is flipped by the industry.
All right. Do you have any advice on helping to guide consumers how to access the care and to choosing the care that's really best suited for them?
Absolutely. Healthcare is personal. You need to have a great chemistry with your clinician, whether it's a physician or an advanced practitioner, whether it's for something very simple or something more severe. So I would first say that you need to feel comfortable with your clinician. If you've never met them before, you can go on to, at least on our website, stthomasdoctors.com, you can actually search our physicians and practitioners, look at their bio, understand where they went to school, what some of their specialty services are, see where they're located, what their hours are, and even schedule your appointment with primary care today online.
All right, a lot of helpful information. Yvette, Doran,
yes,
thank you so much with St. Thomas Health Partners. Really appreciate this explanation.
Thank you for
having us. What you're doing
us
in this community. Thank you.
Our pleasure. Thank you.
And we'll be right back with more after this.